stage. Hi, everyone. Dr. Ejaz here from Pediatric Healthcare Alliance. I'd like to start by saying congratulations to everyone. Exciting time.
Oh,
They're all saying hello on the chat. Yeah.
Yeah. Mm-hmm. And there's a lag even in the video.
So someone wrote, what do you think is the top question new moms should ask a potential pediatrician? That's a good question. So I think that is very personal, actually, depending on whether you have anything in particular that is super important to you. I think that's one of the things that you should lead with when it comes to talking to your pediatrician. And people ask all the time, when they come for prenatal visits, some moms, the first question they ask is about vaccination. Or for some of them, they ask how I like to prescribe antibiotics or different medications, things like that. So you want to really get an idea of whether you and the pediatrician are on the same page on how you think you're going to want to do things for your child. We all have a lot to learn, Erin was saying. Don't worry about that. So when is the first pediatrician appointment for a newborn? Also great question. Also very commonly asked during the prenatal, which I love having that opportunity. And for all of you guys, it's really great to be able to find all of this out beforehand. And for breastfed babies, majority of us would like to see the baby within 24 to 48 hours of discharge from the hospital. And sometimes they'll even say, you just go tomorrow, please. You're being discharged today, and we want you to follow up tomorrow, mostly because we're watching out for baby's weight, and we're also keeping an eye out to make sure that baby's not starting to look jaundiced or anything. So let me see. Do I recommend doing interviews? Absolutely. I do think it's very important, your pediatrician and yourself, to be on the same page, to have similar ideology and thinking. So I think it's great to do interviews beforehand and get to meet a few and see who you feel most comfortable with. When in a pregnancy should you start looking for a pediatrician? I would say somewhere in the second trimester going into the third, so that by the beginning to middle of third trimester, you're already settled. You know where you're going to go. It'll help decrease anxiety for you a lot. Oh, absolutely. Thank you, Amber. Just looking at the chat and responding there. Do you recommend having a backup pediatrician picked out? Sure, I guess. That's not a bad idea, but I can't imagine why you would need a backup, especially if you are choosing a group practice like ours, because we are the built-in backup. So for us, if someone chooses me and for some reason I'm not here, we have another office, which is just about 10, 15 minutes down the road. So we've got 2 backup pediatricians and a nurse practitioner right there. But certainly if you're choosing like a single practice, meaning someone where there's just one doctor, that's a good idea. Let's see what Ms. Shawnice is saying. Does the pediatrician have to be under the insurance of the mother, or can it be the father? I believe that it doesn't matter whether it's the mother or the father, just that the baby needs to be put on someone's insurance within 30 days of birth so that you guys don't get out-of-pocket bills. Let's see. What questions? And same idea, right? So Miss Kayla and Samantha are asking the same type of thing, which is about what to ask when you are interviewing a pediatrician. Again, I think that it really is important to first figure out what is important to you. Are you, do you have specific ideas on certain medications or vaccines or certain things that you want to know that your pediatrician may or may not or will not do, and then focus around that. But if just in general, I think it's good to kind of get to know what sort of things are on the schedule, on the general schedule for all babies, so basically, does your office start vaccinating at 1 month or 2 months? Do you break up the vaccines, or do you go by the CDC recommendations? All of that kind of stuff. Those are the types of things that I would recommend asking. Miss Debbie is asking, how do you recommend keeping babies safe for their appointments during COVID? Yeah, are they too young to wear masks? So they are too young to wear masks, but certainly keeping the carrier covered with a light covering is helpful. And for example, with Pediatric Healthcare Alliance, what we do at all of our offices is called curbside check-in. So essentially you're using your own vehicle as your waiting area. So when you come into the parking lot, you're going to give us a call, let us know that you're here. We're going to come out and give you the paperwork and take care of all of that kind of stuff right there in the comfort of your own car. And when we are ready inside to bring you straight back into an exam room, that's when one of us will come out and get you, bring you straight to an exam room, take care of everything there for baby, and then you go right back. So we are minimizing time spent in the office. Do children automatically join their sibling pediatrician, or do you approach them, or do you need to approach them and request? That's variable on each office, but for the most part, I do believe it's pretty much automatic. You just have to provide all of your new babies' information to the office and just confirm with them that you are going to be starting or going to be bringing the new baby there. Pediatrician versus family doctor. Very good question. Of course, I'm going to be partial and biased to pediatrics, although there's nothing wrong with using a family doctor. Ms. Shawnees asked again, Laurel, about the first appointment. Do you mind putting it in the chat for her answering, since we went over that already? Is there a way to prolong vaccination schedules? Ms. Teresa is allergic to vaccines, and her allergist recommended extending the baby's schedule. So sure, absolutely, there is. And that's something you're going to want to discuss with your pediatrician, and bring the recommendations from the allergist with you, please. That'll be very helpful for your new pediatrician. Okay. I'm glad this is on. Looking for a new pediatrician. Insurance has changed. I don't like that. Oh, okay. Yeah, sorry. I know insurances can be tricky. Definitely good to know exactly what they will and will not cover. Oh, again, so same question. So let's just go over it again. First appointment after birth. For breastfed babies, majority of us will like to see the baby within 24 to 48 hours after discharge from the hospital. For purely formula-fed babies, and depending on whether there are any other potential complications, it can typically be somewhere between 3 and 5 days after leaving the hospital. I'm so glad you guys are finding this helpful. So let's see. Are there other questions? Can both mom and dad come to the pediatrician interviews now during COVID? So for Pediatric Healthcare Alliance, the answer to that question is yes, absolutely. And you can come in person if you'd like to see the office and prefer to come in person. But we also do telemedicine for prenatal visits, which is also great because then you can do it just from the comfort of your own home. Let's see. Ms. Kelsey is saying, I'm a FTM and my husband and I always thought we knew what decision we'd make when it comes to whether or not to circumcise our future son, but recently we're given other perspectives. Pros and cons of circumcision. Very good question. There are many. There aren't too many cons to not circumcising. The pros are the slightly decreased risk of the skin infection called balanitis or balanopostitis, which could happen, which could potentially cause someone to need circumcision later on in life. So it's sort of more of like a preventive measure. But there aren't very many other than that slightly increased risk of potential infection. And that too, some research shows that there is a risk, some research shows that there isn't. So in the end, for circumcision, it really comes down to personal choice more than research-based decision, because as far as the research, there really isn't too much of a difference at all. Let's see. I think I missed one about fever.
Do you want me to read it to you?
Yes, please.
Our pediatrician, we found, said something interesting. Within the first 30 days of life, if the baby has a fever, the doctor will not accept the baby because that is an automatic trip to the hospital. Is this a typical practice for just that doctor?
I see. So someone was asking about fever within the first 30 days of life. I don't understand what they may have meant about not accepting the baby. I think what they perhaps meant was that it is an automatic admission. So typically, yes, under 30 days of life, if baby does have a true fever, which is 100.4 or higher rectally, sustained for more than 10, 15 minutes, would repeat. And then really, if baby does have fever and or other symptoms of illness, it is best to take baby back to the emergency room, because babies can have even a slight infection, like a viral infection, can spread within the body pretty quickly. And so we generally tend to be a little extra cautious with babies under a month of age to make sure that there's no other infection inside the body that we can't see. I have a great pediatrician that I use for my older son, and I'm planning to take babies too, but it is good to think through options. Absolutely, I agree about that. Miss Ophelia is saying that her son's foreskin is stuck to the head of the penis. His pediatrician recommended a cream, but her son won't let him put it on. Separated, yes, it is. Majority of them will separate on their own as they get older. The only time it's an issue is if the skin is touching right at the urethra, right at the hole. So you want to make sure that it's not that close, in which case you do want to try the cream. But otherwise, if it's a little further out and the hole itself is fine, there's no obstruction to the urinary flow, you're okay waiting it out for a little while. But definitely follow up with your pediatrician. Let them know about the issue with him not allowing you to put the cream on. And do newborns who are breastfed more known to lose weight in the beginning, and is jaundice pretty common for newborns? So almost all newborns are going to lose weight, whether they are breastfed or formula fed. The formula fed ones do tend to recover their birth weight a little faster. They tend to do that within a week to 10 days, whereas breastfed exclusively, we give them up to 2 weeks to gain back to their birth weight. Jaundice is a pretty common problem, again, across the board. However, there is a higher risk, by a little slightly higher risk in breastfed babies, just because, again, it takes a little bit longer for mom's milk to come in, and they run that little dehydration for the first couple of days of life, which the body was made to handle for the most part. So it's just a matter of close observation and making sure that there are no signs of anything further needing to be done. But for most babies, it's just a matter of time for mom's milk to come in, and then the weight tends to stabilize and start to turn around, and they start to gain. Yes, please, if we miss anyone's question, I apologize, and please put it in there again. Oh, Miss Kelly is having trouble seeing and hearing. I wonder if there may be a help area.
Yeah, they replied to her.
Okay, great.
Do you see the question?
Miss Tiffany, due December 20th, Pediatrics open near Christmas. Absolutely. So especially for Pediatric Healthcare Alliance, as I mentioned earlier, we have 14 offices. So essentially at least 3 of our offices are open 7 days a week, so that even if baby is born and say you're being discharged on a Friday or a Saturday, you can still come in the following day for a visit. And most pediatricians will have some sort of weekend hours set up. Let's see. Is it common for providers to have an on-call person for nights and weekends? Absolutely. So, and again, for Pediatric Healthcare Alliance, we always have someone on call. We're typically, it's going to be a nurse through All Children's Hospital, but there's always a provider there as well on call. So nurse practitioner or physician will be available to speak to even overnight. And that's 365 days a year, every day. Do we have to give our baby a name right away? Would waiting cause an issue? We're uncertain. We feel the baby may be born without a name. So that is actually a better question for the hospital. I will tell you from my experience, I do believe you definitely have a few days, but typically I know that they want the information for the birth certificate to be done while you're in the hospital. About waiting beyond that time, I think better to ask the hospital. I don't want to give wrong information. No problem. I'm glad you can see and hear now, Miss Kelly. And let's see. Next question. Miss Ophelia, son was born at 23 weeks gestational. If I do end up having my daughter early too, do you know if NICU allows both parents to visit? That's also with pediatrician appointments. So each hospital has their own policies right now. That's going to be a question for the hospital, whether they're doing only one parent or two. And as far as the pediatricians, again, for Pediatric Healthcare Alliance, we are allowing both parents to come for all visits. Okay, so right, with fever, true fever. So first I would recommend, like, if you've already established with your pediatrician and baby gets a fever, I would give them a call still, whether it's, the on-call physician or during the day, touch base with them, let them know what's going on and let them advise. That is the best thing to do. However, in general, yes, fever, true fever under the age of 30 days is typically an automatic admission to the hospital, just to make sure that there are no signs of any serious infection going on inside that we wouldn't see otherwise. Okay, Miss Alicia is saying, if you don't file a name before you leave the hospital, there is a substantial charge. At least it was in California. Interesting. Yeah, didn't know about that. Not sure. How do you set up an appointment to screen with pediatrician? So if you have a particular group or office that you're interested in, I would give them a call and ask them to set up an appointment for a prenatal appointment. That's how we do it. And for Pediatric Healthcare Alliance, you can even do it online at pdalliance.com, and you can choose which office you would like to go to and even schedule that way, I believe, right, Miss Laurel? Yeah. What are you recommending for family visits for new babies, grandparents, aunts, uncles, extended family? Very good question. Very pertinent to the time, especially. In general, even pre-COVID, there was the recommendations have always been to avoid crowds, avoid parties, malls, things like that for baby, because again, under 30 days and sometimes even under 60 days of age, fever needs to be taken seriously in baby and can result in an admission to the hospital. So now with COVID just being on top of it, another possibility for causing fevers, etc., it's just important. It's going to be a personal decision, but I would say it comes down to your family unit, and you have to just really take into account how much of a risk you're taking by every other person that you're accepting to come and visit baby, and then you guys just have to discuss. And I think that's something that I think I would talk to the pediatrician about even prior. Again, that's something you can talk about in the prenatal visit. That way the pediatrician can help you specifically about how your family is planning on doing it, and maybe they can provide a little bit further guidance. But in general, yeah, you really want to limit how many people are handling baby and coming close to baby, especially in the first month of life. And everyone should be wearing masks and, of course, have washed their hands very well. And I always recommend putting a baby blanket on someone before allowing them to hold baby as well. So let's see, what about certain immunizations for family members? Recommended for all people who are going to be around newborn baby to have had the Tdap, which is the tetanus pertussis booster, as well as the flu vaccine. And those are the two major ones that come to mind that everyone should have. Should you have a pediatrician and a regular doctor? I'm new to my area and need to know if I need to find a family doctor for myself and baby or just myself. That's the question from Miss Shannon. So yeah, I personally believe it is best to have a pediatrician for your child as well as having a primary care physician for yourself.
So we had some questions from our prior chat, from our booth chat window, one of which somebody asked, how does a virtual prenatal visit work?
Sure. Okay. So the question that came in earlier was someone asked, how does a virtual prenatal visit work? Basically, once you call to get it set up, they will email a link to you. And for us, we use GoToMeeting, which means that we will ask you to either download it, or if you're going to do it from a computer, you can use it web-based. On your computer or your phone, actually, you could do either. And we will send you the information at the time of the visit. You would just click the link, make sure you allow your audio and video to be enabled. And that's pretty much it. It's a pretty easy, quick process. Then you and your pediatrician, potential pediatrician, could be face-to-face virtually, sort of like we are now, but I can't see you guys. And just ask all your questions. And for me, I know my office is small enough. I can pretty much usually even take you guys around virtually and show everyone the office, and we have time to chat like we would in person. I hope that answers that question. Miss Andrea is asking, what was the other you suggest people around baby to have other than the Tdap? Oh, flu vaccine. Do you have locations all over the US, or is this Florida specific? So Pediatric Healthcare Alliance is Florida specific and mostly in the greater Tampa Bay area, including St. Pete.
So let's see, some other earlier questions were, any recommended books we can get to read up on baby care, first-time mom, if you have any good recommendations.
Actually, books have kind of changed. Back in the day, or not too long ago, it was always what to expect when you're expecting, and then what to expect in the first year of life, etc. Those books were always very popular. But nowadays, I find that it's more apps and websites that people are using more than books. So certainly there are very many. The AAP has a lot of information online, but those books are still available. I'm just trying to think if there's anything else in particular. I haven't come across any new books, honestly, that people have been using. I find most people using the parenting apps, which are very helpful because then they can give you, what to expect every visit kind of thing. And that's something that helps you to know what you're walking into before the visit happens. Let's see, there's a new question from Ms. Deborah. With talks of all the COVID vaccines now, how long do you expect before a vaccine will be available for infants? Should we hold off even when it's offered since no testing is done on infants? Well, I think actually it's not even going to come out for infants until testing is done on the infants. So at this point, unfortunately, I think we're still looking at quite a while, meaning, within this next year, adults, they're looking to get all the adults vaccinated, and they are starting trials on children, but I don't know if that's going to include infants. Nothing has come through across my desk saying that it would within the next year. So until it's tested, it won't even be available or recommended for infants. So we'll just have to wait and watch. What about COVID vaccines while pregnant? Excuse me. We don't have any recommendations yet because those studies have not yet been done on pregnant women yet either. So we'll have to wait for those to come out from the CDC.
We had another earlier question, which you might want to repeat because I don't know if you can hear me, about seeing ads for sleep aids for babies and whether they're safe, and it specifically said melatonin.
The question from earlier was about, you can just let it fall, sleep aids for babies, including melatonin. Yeah. Is that correct?
Yeah, the mom said she'd seen advertisements about sleep aids for babies and not sure if they're safe.
I honestly, absolutely am not about giving babies anything they don't really truly need, and have not seen research done on sleep aids or typical use of melatonin in infants. So personally wouldn't recommend it. And if there is anything, I would really have to read about it because it's not something that's part of my general practice.
Maybe talk to them about the hospital checkup for the first-time parents who may not be aware that that's a.
Sure, sure. So we talked a little bit about when you guys would see your pediatrician after the hospitalization, but during the hospitalization is also another time when pediatrics is very much involved. So whether it is, say if you guys are, or if someone's going to be following up with me here at Pediatric Healthcare Alliance in Trinity, and they deliver at St. Joseph's North, which is where we round, once they get to the hospital, they would let them know that their baby is a Pediatric Healthcare Alliance patient, and one of us, myself or my colleagues, would be rounding on the baby during the hospital visit. That simply just means doing the baby's physical exam and care during the hospitalization time. So if it happens to be that you're delivering in a hospital where we wouldn't be rounding, it's still okay, and it doesn't mean that you have to join the office of someone who would only round in the hospital. Meaning that, for example, if a mom is delivering in Trinity Hospital where we don't round, it's still okay. The on-call pediatrician in the hospital will do the physical exam and take care of baby for the day or two that they're in the hospital, and then give all the information to you to bring to your pediatrician when you are discharged, and that'll have all of baby's information on there. So then we just pick up right from there. So in the hospital, it's all about just making sure that baby's physical exam is good, that all is copacetic, that there's nothing else that we need to watch out for. And of course, if there is, they'll give you recommendations about what to follow up on with your pediatrician once you're out of the hospital. Or of course, if it's us, we already have the information and we'll just keep going from there. We have some new questions on the chat now. Do you have any recommendations on introducing baby to family pets? Actually, I do. So especially for dogs, they say it is best to, prior to going home from the hospital, take one of baby's blankets or articles of clothing home with you to allow dog to smell it and become used to it prior to baby coming home. And then just being gentle with introducing the baby to the pets. Depending on, you of course know your own pet's personality, but typically dogs can sometimes either be very protective, and that's, one way, or sometimes they can even, just like other children, be jealous. So you've got to kind of suss it out and see how that goes. And if for cats, I don't think you need to do the clothing article to have them smell prior, but certainly just going carefully and just allowing them to sort of come over and make them, a part of understanding that there's a new member of the family now, really. Are there any specific foods or things we can do as mamas to help the quality and or quantity of breast milk production, either prior to having baby or after? So as far as quality, of course, they do say, higher fat foods, and just keeping yourself very, very well hydrated. As far as supplements for quantity, fenugreek is one that I have researched, and I've found that it's very safe, and that does seem to help according to the research. But certainly here at PHCA, we also do have lactation consultants to help with questions like that. Is vitamin D something that should be started right away with a newborn? It should, especially if it's an exclusively breastfed newborn. If you are going to be doing formula, then you do not need to do vitamin D. I don't know if this is a pediatrician question or not. We want to have our baby sleep in his room from night one, not in our bedroom. Is this okay? So actually, that's a really great question. The American Academy of Pediatrics recently changed that recommendation, recently meaning within the last couple of years, that co-sleeping, of course, is not recommended. However, sleeping in the same room with baby has actually been extended to 6 months. So it is recommended to have baby in the same room with you from day one up until baby is 6 months of age. So you do want to actually make room to have the bassinet next to your bed. It will make things a lot easier for you. Miss Jamie says, I have a lot of food allergies. How is this going to affect our newborn from not getting any of these foods? Are they going to be at higher risk for allergies? Are the allergen packets to add to milk safe? or are there more cautions I should take? So I think that really depends, Miss Jamie, on what your allergies are and how extensive they are. I would recommend that you speak with your allergist actually to get recommendations specific to you and your baby. But in general, yeah, we are recommending the initiation of allergens earlier in life rather than later now, thankfully. You're welcome, Miss Kendall. And let's see, Miss Kayla, do you have any suggestions on how to have those hard conversations with family members who maybe have different views than us, like family members who don't want to wear masks around baby? I totally understand. One of the most difficult things to do in the time around having a baby is, especially nowadays, having these conversations with family members. And I think in the end, the best thing that I can recommend, I think, is having sit down with yourself and your spouse first so that you guys can really come to terms with exactly what you want, and then maybe even put like bullets together so that you know exactly you guys are both on the same page, and then just set aside a time to really just have those conversations prior to baby's arrival with all those family members. I think that's what I would recommend, is first you guys know exactly what you want to do, and then even write out like a little script and just give those people a call virtually or in person, however you want to do it, and just do it prior to baby's arrival so that everybody already knows. That'll help to decrease the anxiety around all of that. Everyone knows what to expect. Ms. Kayla asks, limits or types of cleaning supplies that are not recommended to clean in the home with a newborn. So, if we think about it, we use all kinds of harsh chemicals, et cetera, in the hospital because we have to. So in the home, I think, of course, I personally try to decrease the number of chemicals used. Sometimes you just have to. Personally, I am a big fan of like vinegar or using bleach in the home every once in a while if needed, but then you do want to make sure that you dilute it and not have baby in the same room so that the fumes don't get, or so that the baby's not smelling it too much. I think that's a great question. Let's see. So I'm going to take a sip of water so I can keep talking to you all. Let's see, along the same lines as the question of how to have conversations with the family members, I recommend to all of you, whether you're new to having babies or not, I think that is still one of the hardest things that happens to new parents, is even with different children, all the information that you're going to get from everyone and everywhere. Everyone has their own say on how they think that baby should be taken care of and all of that kind of stuff. So I always recommend to parents, even prior to having baby, if you guys could sit down and really openly talk to each other and talk about all the important things that you're going to have to be dealing with, how for this side of the family, what works, for this side of the family works, but for this unit that we have now, what is important to us? And if you are both spouses are on the same page on what is important to you, it will make that transition so much easier. And then it makes it easier for you to bring all that information like, oh, well, these people said this, these people said that, but what do you think? You can even bring that to the pediatrician then if it's something pertaining to, baby's well care or medical care in general, and they can help make sense of that for you or help to sort of filter through the information if that makes sense. Ms. Karen asks, why do they suggest 6 months sleeping in our room? Yeah, actually, so initially it was about SIDS, but it's also other things that they have just noticed that, certain babies with reflux or even otherwise just keeping an eye on, majority of it boils down to SIDS, and just they found that the babies who were kept in the same room for the first 6 months, the incidence of SIDS was decreased. SIDS meaning sudden infant death syndrome, which is basically death of an infant without knowing why exactly it happened. So let's see, when is it safe or recommended to travel with baby? Another situation that has changed recently due to COVID. So in general, personally, I used to say for international travel, especially, minimum of 4 months, just to know that you had the 2 months and 4-month vaccines on board already and then go. It's just a safer way. But does that mean you can't travel prior to 4 months? No, absolutely not. I think right now it's also a matter of checking where you're planning on going and how important it is and whether it would be flying or whether it would be driving. All of that kind of stuff really needs to be taken into account to decrease the risk of the family to COVID. Yes, Miss Kelsey is agreeing about everyone being on the same page. Thank you. And we only allowed people who were on NICU on the NICU list. Once he got a little better, we allowed others after washing hands and using blankets. Yeah, I agree with all those recommendations. So what should you do if baby has reflux or spits a lot? Really comes down to whether, so like every baby is going to have a little bit of reflux because all their systems are still immature. So a little bit of spit up is pretty typical actually. Whether baby has reflux disorder, which is affecting them, affecting their feeds, possibly affecting their ability to gain weight, things like that, are all the things that your pediatrician is going to be following along with you. We don't commonly have to put babies on medication for reflux, but certainly it does happen from time to time. What is colic? It's a good question. Colic is generally after 2 weeks of age. They say babies who end up crying for about 2 hours or more at a time, but not straight. It tends to be bouts of crying, and there's no other reason that can be found for it. Typically will be sort of diagnosed as colic. And there are different, but so it's, if you feel like your baby is colicky, possibly something you definitely want to talk to your pediatrician about. There are certain things that could possibly be done to help. So, so definitely talk to your pediatrician and see, is it something else or is it colic? And then they'll help you take it step by step. Do you approve of the owl footwear that keeps track of baby's heart rate, etc.? And then the next question is similar, so the booty heart rate and oxygen monitors. It's not that I don't approve of them. I definitely think they have a place, but I also have found that they can definitely increase parental anxiety at times. So I'm going to say on that one, I would say really think about it and do take into account whether you, being honest, whether it will actually really help make you feel better or whether it may just be something that you're going to find yourself looking at and trying to track all the time, which there's always going to be ups and downs. So honestly, we don't really need them at all. How many days, weeks before due date do you recommend you take off work? That's actually going to be more of a question for your OB-GYN depending on your particular situation. For the most part, it's not necessary to have to take off just prior, but it also depends on what kind of occupation you have, how much time you really have to prepare. So personally, I would say if you have time to prepare or if you could take a little bit of time off, it may just help decrease the stress and anxiety of everything. But certainly, it's going to be a personal decision. Miss Hemrashmi is asking, baby is super gassy, what to do to help? Again, I'm going to say definitely talk to your pediatrician about that one because most of these things, you know, it is gas or it is colic, but there are other things that need to be seen. And that's why I recommend seeing the pediatrician and talking to them first, because we don't want to just self-diagnose and just, oh, I know this is it. because you want to just make sure there's nothing else to it, and then allow that to be the diagnosis and have a conversation. In general, you know, there are certain over-the-counter medications that can safely be tried, but again, I think it's really recommended and best to talk to your pediatrician about these sorts of things. And especially for us with Pediatric Healthcare Alliance, that's one of the things that I love about having the ability to call us at any time, you know, knowing that there's always someone on call to talk to, and that way we can help recommend, because what I think most importantly is not just taking it on yourself. You know, don't be afraid to call, don't be afraid to reach out and ask the questions you need to know. It's better for you to reach out. It's okay. Yeah, you're welcome.
Maybe have we talked about timing of choosing a pediatrician for those who are expecting?
We did. Okay. We did talk about timing of choosing a pediatrician. I do recommend, especially if you're going to take time to interview a few, that you do it sort of at the end of the second trimester, so that you are set by early or middle of third trimester. That's my recommendation. Let's see, any other questions, guys? Oh, it's already 12:40. That went pretty quickly. I feel like I've been doing a lot of talking, but I think we covered a lot of stuff. I'm trying to think if there's anything else. I think typically, oh, there's a question from Miss Kelly. We are vegetarian. Is it okay to raise baby vegetarian, or do you recommend introducing meats just to be safe in the early years? So Ms. Kelly, that's a great question. And personally, of course, there's nothing wrong with being a vegetarian or raising baby vegetarian. It's really all about making sure that they have enough of the essential vitamins and the proteins. So especially wanting to make sure about that. And then if you're okay adding meats, you can certainly do that for the first couple of years and then go back, or you don't really need to, as long as there are, you know, you're making sure they get enough B12, D, calcium, and protein is important. Let's see. You're welcome, ladies. And Miss Shawnee says, does the wood material of a crib matter? I was like, what's a C-rib? You know, that's a good question, actually. And people have asked recently about the mattress materials as well. I'll say I have not seen any major recommendations coming through from the AAP on that one. So I think as long as it's, you know, properly made and there's no recalls or anything, and you have checked out the reviews of those certain cribs and stuff, I think it's okay. So Miss Janine is asking about recommendation for sunscreen. So in general, 6 months and up, sunscreen is definitely recommended. Prior to that, and I personally always recommend sort of like the more natural kind, but you do want to make sure you have an SPF of at least 30. Under the age of 6 months, you want to just have more of a physical blockade. So long sleeves, long legs, even if it's a light, just like a cotton covering, just so that baby's skin is protected, or having an umbrella or covering on the stroller or car seat prior to the 6 month age. So let's see, are there any questions there that are a must to ask pediatricians? A must. I think it really all comes down to knowing how the pediatrician practices. Personally, I like to know more about, like, again, each family are being comfortable and knowing that, you know, antibiotics will be used if necessary, but how do they feel about antibiotics in general, and making sure that you guys are on the same page of vaccination, you and your pediatrician. I think those are the two most important things, is medications and vaccination, so that you guys know going into the relationship how you both feel. Let's see. Thank you. Thank you. You're welcome. And so Miss Angel is asking, would it be okay to give a 3-month-old the first foods? Recommended to wait till 4 months of age at the very earliest for complementary feeding. Babe, Erica is saying my baby is 4 months from a week from 5 months. Is it okay to start baby cereal or baby foods? So in general, it is, but again, I recommend talking to your pediatrician about your case in specific. Sometimes some pediatricians wait until 6 months of age, so do discuss with your pediatrician first, please. Oh, you're welcome. Thank you all. Hello, Miss Mallory. So do you have any questions since you're joining in? And I think we're probably going to be finishing up in the next few minutes. So if anybody has any last minute questions, please do put them in the chat now. You're welcome, Miss Erica. Let's see. Essential oils safe around baby? Very good question. So I would say in the air, yes, but I would still like there to be some distance so that it's not too close to baby's face. So at least a few feet. So if you can have it sort of on the other side of the room, that would be good. And just making sure, again, with the essential oils that they really are pure essential oils, that's going to be helpful. I don't necessarily recommend putting any essential oils topically onto baby without talking to your pediatrician first. Thank you, Miss Janine. And thank you all. Let's see if there's anything else I can come up with at the last minute. We talked about hospital, we talked about, yeah, I think we've covered a lot of stuff, even over-the-counter medications, I think. In the end, I would say, yeah, please do your best, find a pediatrician prior to baby being born, and I wish you all the best luck, and if there are any other questions, I'm happy to still answer them. Are pump and dump safe? So sure, they are. It's safe, but it depends on why you would need to do that, really. So again, that's something you're going to want to talk specifically to your pediatrician about. But yeah, it's safe. But the question really being then, if you're pumping and dumping, are you going to be supplementing baby with formula, or are you going to supplement with stored breast milk or that kind of thing? Did we talk about safe sleep and products like DocaTot? I'm not sure what DocaTot is. We talked about safe sleep. We talked about co-inhabiting in the same room for the first 6 months according to the AAP guidelines. And we talked about co-sleeping not being recommended. I'm wondering if DocaTot is similar to that Owlet situation where you're looking at the heart rate and the pulse ox, which we talked about really not being necessary, but certainly something depending on your personality that may be helpful, or if it could be anxiety producing, so be careful with that. Let's see. Oh, thank you, Miss Kelsey. I'm really glad you enjoyed. Okay, yeah, that was it then. DocaTot is like a lounger. Yeah, I'll have to look that up. I'm not sure I'm not familiar with that one. Sorry. Thank you. Thank you all.